This is our unaudited schedule of what has happened to the share prices of all 59 new publicly held commercial-stage oncology-focused biopharmas over the last 12 years. This is literally all 59 public biopharmas that had a first cancer drug approved since January 1, 2013, sorted oldest to newest by PDUFA date. This video is dated as of the close of trading on Friday, February 7, 2025. This is not investment advice. We start with the entity's ticker symbol, the name of their first product approved, PDUFA date when available, date approval was disclosed, and the number of days difference between the two. In this next column we note the BIOS share price as of its close a full 2 trading days after approval. We then note which were acquired or merged. From here we segregate this 59 company peer group into 4 categories. Our first category includes these 13 acquired at meaningful gains versus their share price 2 days after approval. Using the share price 2 days after approval may not be the best or an ideal metric, but it is a consistent metric. In this column we note the date the acquisition was announced and then the number of months between FDA approval and the date the acquisition was announced. The last trade is reflected here, more or less the M&A share price. The percent gains are noted here in green. Folks, if there is one takeaway from this video or analysis, it is that 12 of the 13 sold at meaningful gains were acquired within 2 years of FDA approval. This will be important later. These 13 make up 22% of the 59 in this peer group, so just less than 1 in 4 were acquired at a meaningful share price gain. Our second category are these 7 sold at meaningful losses versus their share price 2 days post-approval. The date the acquisition was announced, like before, is reflected in this column, and also the number of months between approval and the date the acquisition was announced is reflected here. Percentage losses are noted here in red. Folks, note 6 of the 7 sold at meaningful losses waited for well over 2 years to sell. Now there may have been valid reasons for waiting. Deciphera, for example, hoped its Qinlock would move from 4th line to 1st line for stomach cancers. G1 hoped its Cozilla would work in colorectal cancer. G1 had 2 other therapies in development that never worked out either. Whatever the reason or excuse, 6 of the 7 that waited were sold at big losses. This third category are the 3 that either went bankrupt or were otherwise later delisted. Last trades were for pennies a share, resulting in total losses for those who held. Our fourth and final category are these 61% of the total peer group, that are still independent today. The BIOS closing share price on Friday, February 7, 2025 is noted here. Percentage changes in share price as of today versus 2 days after FDA approval are noted here. Losses over 10% are in red. Losses up to 10% are in yellow. There are 5 that trade higher, noted in green. Now a very small handful of these 36 sold their cancer therapy or took it off the market, but, big picture, as of today, February 7, 2025, as noted at the bottom, only 5 trade higher than they did 2 days post-approval. Can you believe that? Only 1 out of every 7 new commercial-stage oncology-focused biopharmas still independent trade higher today than they did 2 days after FDA approval. This is not investment advice, but the flip side is there is some evidence that suggests current valuations being down may only be temporary for some of the more recent BIOS in this peer group, especially Iovance. Notice also only Delcath Systems has generated meaningful share price gains for their shareholders. That may be great, but we'd note Delcath's market cap was well under $100 million at approval and is roughly $500 million today. Delcath's market cap gains are not linear to share price gains due to unavoidable dilution. What do you take away from our summary? It's our recollection that it used to be considered conventional wisdom that healthcare entrepreneurs sell to big pharma after FDA approval. Patients win, shareholders win, and healthcare costs win via scale from consolidation. Small cap bios used to be considered obvious feeders to big pharma. Also remember, all new drugs are worth some net present value of their total cumulative revenues or gross margins projected through patent expiration, at some discount rate. Do you believe a drug becomes more valuable as it ages? Back to our list, let's look at Day One and their Ojemda therapy approved last April. A simple Google search and ChatGPT request suggests Ojemda is only patented through June 2035, roughly 10.5 years from today. These are not authoritative but appears consistent with Day One's last 10K. These are Ojemda's average analyst consensus revenue estimates per Fintel and Seeking Alpha. These are also consistent with these published estimates from Needham and Goldman Sachs. Let's then assume 5% annual revenue growth from the last year estimates are available through Ojemda's June 23, 2035 patent expiration. Let's now add a row below the revenue estimates by year that reflects the total cumulative revenue projections through patent expiration as of the end of every year going forward. All amounts are in millions. If we graph total cumulative projected revenues through patent expiration like we've done here, it is absurdly easy to see why Ojemda, like any new drug, will become less valuable over time absent label extensions. Is this very consistent with our summary of all 59 that showed 12 of the 13 commercial stage oncology-focused biopharmas acquired at meaningful gains were acquired within 2 years of FDA approval? Let's even show the number of years to patent expiration. With all of this, ask yourself, do you believe Ojemda will be more valuable at the end of fiscal year 2028 when it is forecast to generate $6.72 billion in total cumulative revenues through patent expiration, and will have 6.5 years to patent expiration than it is worth today with 10.5 years? What about the risk of a competitor developing a better drug over the next 4 years? We used Day One in this example, but we strongly suspect the same math is applicable to all commercial stage oncology focused biopharmas in this peer group, and non-oncology for that matter with a like patent life profile. For perspective, this is a graph of Phathom Pharmaceuticals' share price since adding a new risk factor to its last 10Q on November 7, 2024, suggesting Voquezna's patent may expire 2 years earlier than thought. Wow, down 70%. Moving on, some may say pipelines of the independents in this peer group may lead to a second FDA-approved cancer therapy. Folks, we're sorry, but the odds, again the odds, are overwhelmingly against it, and here's why. Time and again, study after study from regulators and trade groups alike, reviewing thousands of drug development programs from big pharma and small over the last 30 years, 3 studies noted here with links, have consistently shown only 2 to 5% of new cancer drugs in phase 1 trials are ever approved. Said another way, 95 to 98% fail. Also note this one study ranked phase 1 to approval success rate by biopharma area of focus. Oncology is clearly the most difficult. This is an abysmal success rate but demonstrates why cancer drugs are so valuable, especially just after FDA approval. Back to our list of 61, we suspect all 61 had pipelines. Of all 61, only Blueprint and BeiGene were fortunate enough to get a second cancer drug approved here in the US, roughly 1 of every 30. Tesaro's first approval was not to treat a cancer and turned out a commercial dud anyways. Incidentally, Tesaro was sold within 2 years of Zejula's approval. Let's not get into it here, but how many commercial stage non-oncology, again non-oncology focused biopharmas do you know that had a major second product approved the last 12 years? You cannot name more than 3 in non-oncology over the last 12 years. Of course, there may be other exceptions like Blueprint and BeiGene. Okay folks, let's summarize the 6 compelling data points considered in this analysis. You then try and tell us shareholder value in commercial stage oncology focused biopharma is not maximized via M&A within 2 years of first FDA approval. In this analysis we've shown, number 1, 13 of the 59 new commercial stage oncology focused biopharmas over the last 12 years were sold at meaningful gains, generating significant wealth for shareholders. This is the only objective of any company, bio or otherwise. 12 of the 13 were sold within 2 years of FDA approval. Number 2, 7 of the 59 new commercial stage oncology focused biopharmas were sold at meaningful losses. 6 of these 7 waited for well over 2 years to sell. We're not even including the 3, like once high-flying Clovis, that went bankrupt or were delisted. Number 3, only 5 of the 36 new commercial stage oncology focused biopharmas over the last 12 years that are still independent, trade at a higher share price today than 2 days after FDA approval. Number 4, we demonstrated very simple math that strongly suggests new drugs become less valuable over time as they get closer and closer to patent expiration. Number 5, historically 95 to 98% of new cancer drugs fail, so pipelines do not appear to be a credible mechanism to generate meaningful incremental shareholder valuation. It appears akin to rolling the dice. Put simpler, obviously a new commercial stage oncology focused biopharma beat the enormous odds once. Why in the world place a bet to roll the dice again with shareholder gains when the odds are so dismal? Which leads us to number 6. Only 2 of the last 61 new commercial stage oncology focused biopharmas over the last 12 years have gotten a second meaningful cancer therapy approved by the FDA. You know, none of these 7 mention the virtue of M&A to scale healthcare in general and its positive effects on costs via consolidation. Have we not clearly demonstrated the odds? Again folks, the odds are clear if not obvious that shareholders are almost always best served via M&A exit strategy within 2 years of FDA approval in commercial stage oncology focused biopharma. We'll even give you a sneak preview. The message is more or less the same in commercial stage non-oncology focused biopharma. We will update this analysis in late August after the peer group has reported a few more quarters of progress. Incidentally, we will post a like review of commercial stage non-oncology focused biopharmas shortly. Those of you familiar with this space may notice our list does not include zanidatamab's approval from last November 20. We excluded Jazz because Jazz is an existing commercial stage biopharma in both oncology and non. Zymeworks is excluded because it has no commercial responsibility. Zymeworks only earns a royalty. We'd genuinely like to know what you think. Are you aware of any evidence or data points that suggest shareholder value is historically maximized when commercial stage independent oncology focused biopharmas stay independent? Do you believe valuations in this peer group will bounce back? Please let us know in the comments. Otherwise, please take a moment to like and share this video and follow us on social media. Again, we will revisit this analysis in late August and provide a like analysis of commercial stage non-oncology focused biopharma after Q4 results of operations have been reported. Thank you.